Hello everyone, welcome to Talking Health with Dr. Laz, your favorite health program on television, reaching you from Nigeria's capital city, Abuja. My name is Dr. Laz. Cancer is a malignant tumor, and of course it involves uncontrollable division of cells and of abnormal growth of tissues that could be harmful and lead to death. It's a very common killer disease, and the World Health Organization estimated that at least 10 million persons are being killed by cancer. And in Nigeria, about 8 out of 10 persons who have cancer get to die. And of course, late detection is a common feature in Nigeria and many other parts of the developing world. There are various ways of treating cancer, ranging from surgery, chemotherapy, brachytherapy, radiotherapy, and all of that. And there's been research and a number of global advancements in cancer care. And that's what we are going to be talking about today. We have someone who is an expert in this space when we are talking about proton therapy or proton beam therapy. It's a form of radiotherapy that's, is not currently available in Nigeria, but available in other parts of the world, and is gaining a lot of attention because it has less side effects when it comes to radiotherapy. I wouldn't be saying so much about it because I have a senior consultant radio-oncologist who will be joining me, but that will be after this break. Do stay with us, we'll be right back.
The team examines the patient and advises investigations. On completion of investigations, the details are reviewed by a multidisciplinary tumor board to decide whether the patient will benefit from proton therapy. Clinicians contour the target as well as the organs at risk and prescribe a treatment plan. The medical physics team then creates a proton therapy plan, and often proton therapy improves local control and therefore outcomes in some situations, reduces the toxicity of radiation in others, and does both in many clinical situations. Head and neck cancers are the commonest cancer in India, and this is naturally our area of focus. In these cancers, proton therapy reduces the long-term and short-term consequences of treatment as compared to techniques like IGRT and IMRT. In the short term, we have noted that this means less risk of pain.
Yes, one of the cancer management experts or oncologists you saw in that video is here with me in the studio. I'm happy to welcome Dr. Sapna Nangia. She's from Apollo Cancer Center. Apollo Hospital is a very big hospital in India, and they have a lot of specialties, but Apollo Proton Cancer Center in Chennai, India, a senior consultant radio oncologist. You're welcome to the program.
Thank you very much, Dr. Laz. Thank you very much for having me on Talking Health with Dr. Laz. Very happy to be here today.
Thank you. This is your first time in Nigeria.
It is my first time in Nigeria.
We are happy to have you on this studio.
Thank you so much.
All right. Proton therapy is one of the most recent advancements in ensuring precision in cancer care, especially for cancer of head and neck and all of that. Please tell us more about it. What is proton beam therapy?
So, as you know, radiation therapy is a very important component of treating cancers, and about 70% of cancer patients are going to require radiation at some point of time during their journey. Proton therapy is a specialized form of radiation. So basically, while X-rays use basically electromagnetic radiation, a waveform to kill the DNA of tumor cells, proton therapy uses positively charged particles to kill the tumor cells. Because of that, there are certain things which are different from radiation, and the primary thing that is different from radiation is, as you mentioned, that the side effects are less. The reason why the side effects are less is that protons only travel to a particular point and deposit all their energy, and no energy goes distal to that point, does not go beyond that point, which allows the normal tissues to be spared better.
Right.
And that is basically what proton therapy is.
Okay, so the common one we use, form of radiotherapy we use here in Nigeria is the photon beam therapy.
Yes.
So how is it, you talked a bit about it, so can you make a quick difference between the photon beam therapy and the proton beam therapy?
Yes, so photon beam therapy is of course the, you could say, the main way in which radiation is used. Photon beam, that is the traditional method of using radiation.
Right.
Protons, as I said, and when we are talking about protons today, we are talking about the third generation of protons. Okay. So it's not that protons are a new treatment, they've been around for 50 years. However, the proton therapy that is available today, 2022, or say for the last about 10-15 years, is a special form of proton therapy called pencil beam scanning technique. And what happens with that is that the proton beam, like a 3 millimeter beam, can be made to literally paint the tumor layer by layer. And what proton therapy does is that the radiation is limited mostly, I wouldn't say entirely, but mostly to the tumor.
Tumor cells, yeah.
And because of that, there are two advantages or two differences from radiation therapy. One is that it allows us to spare the normal tissues better.
Okay.
And then at times it allows us to give a higher dose to the tumor because we are able to spare the normal tissues better.
Right.
So that's a twin advantage. Another very interesting observation that has been made is that you know, all these technologies, radiation therapy, proton therapy, act by causing breaks in the DNA of the tumor.
Okay.
So the breaks in the DNA of the tumor, when by normal radiation, may be single strand breaks or double strand breaks. Single strand breaks can be repaired easily, double strand breaks are a little more difficult to repair. While proton therapy, because the energy deposition is very intense, it allows, it is mainly in the form of double strand breaks, which means many radio-resistant tumors, for example, chordomas. Chordomas are tumors, are basically you know, lesions that occur in midline sites in the body, in the skull base or in the spine or in the sacrum. Now, traditionally they are considered radio-resistant tumors.
Right.
However, with proton therapy, the response is very good.
That's good. You've talked about chordomas and a lot of head and neck tumors, CNS tumors, you know, get responsive, and also childhood. So, generally speaking, what are other types of malignant tumors that, you know, does very well with proton therapy?
So children, as you mentioned, do remarkably well simply because you know, they are very susceptible to the radiation dose that would be received by the normal organs.
Okay.
So the dose received by the normal organs can cause growth retardation, can cause cognitive dysfunction, can cause hormonal abnormalities, and when the dose is restricted, these things don't occur. Similarly, in head and neck cancers, you know, when we are treating a head and neck cancer, the inner lining of the mouth and the cheek and the throat is so sensitive to pain, and that leads to many consequences like you know, an increased painkiller requirement and increased requirement of tube feeding or hospital admission. Now that happens less with proton therapy.
Okay.
Another very interesting application has been in liver cancer. Now what you can imagine is we are trying to treat a liver cancer inside a normal liver, and the normal liver doesn't tolerate radiation very well. So you want to treat an organ inside a sensitive organ. Proton therapy allows us to treat that in a very effective manner. Children, of course, as I mentioned, and then there are widespread applications across various sites. So for example, lung cancers in patients who have bad lungs, for example, you know, we are able to treat them without it impacting their respiratory function.
Breast cancer, cervical cancer, prostate cancer, the three most common cancer in Nigeria, and of course a lot of sub-Saharan Africa. So does proton therapy provide a better treatment alternative?
So that's a very nice question, and in fact I also noted this fact that prostate cancer and breast cancer are one of the most common cancers in Nigeria. So, as far as prostate cancer is concerned, there are two scenarios where we can think where proton therapy is offers an advantage over photon. One is in young men. When young men have prostate cancer, the consequences, including a risk of second cancer, becomes much less with proton therapy. And when patients have high risk prostate cancer, when we say high risk prostate cancer, we mean a more aggressive form of prostate cancer, or where we need to treat the nodes, or where the nodes are involved. There again, proton therapy allows us to spare the bone marrow, the small bowel, the bladder, the rectum, and also potency related hormonal issues much better with proton therapy as compared to photons.
That sounds good. What's the duration of treatment? I know it might differ depending on the type, the size of cancer, but commonly what's the usual duration?
So, in breast cancer, we normally treat in 15 sittings. That is very helpful where patients have a higher risk of having a radiation related heart problem, such as patients with left-sided breast cancer, diabetic patients, patients who are hypertensive or obese, or who've had previous heart disease. Now, this segment of patients is more likely to have a heart problem, and proton therapy reduces that. That's a 15 session session treatment. Others may vary. Prostate may vary from 8 to 20, and head and neck is typically 30 to 35 sessions.
Wow. Okay, so what are the side effects?
So, the side effects are, I should say, the same as radiation, but what is different is that their intensity is much less, their occurrence is much less, and their frequency is much less. So, everything, so
that's
the intensity,
the traditional
yes, as compared to traditional,
like
that
loss of hair, diarrhea, and all of that, but the intensity is much less.
Very right, very right.
So, you mentioned about the pencil beam scanning technology.
Yes.
And earlier in the discussion, can you tell just very briefly about it, as well as the intensity modulated proton therapy, which the intensity modulated proton therapy, which I'm sure you are providing in your facility.
Yes, yes. So, the earlier proton therapy machines, as I said, were very cumbersome, and they required a particular kind of device to be created for every part that had to be treated. So, you had to create 2-3 sort of apertures or compensators to match the shape of the tumor, and even then you couldn't do it as effectively. With pencil beam scanning technique, what happens is, as I said, there is a 3 millimeter beam, and with that you can literally paint the tumor. When you use a very sophisticated computerized algorithm to then make sure that the tumor is being treated perfectly and the normal organs are being spared, using what we call a multi-field optimization technique, which means that we have 4 or 5 beams and each of them is contributing, that is IMPT. So, each of them is contributing in a differential manner to make sure that nothing is getting, that doesn't need to be overtreated, is getting overtreated. That is IMPT.
Okay, so what's the success rate for proton beam radiotherapy?
So, for certain sites, it's remarkably better. For example, skull-based chordomas or chordomas in general, we say between more than 80%, 85% of patients remain well in the long run. Similarly, skull-based adenoid cystic carcinoma, we would say more than 90% of patients remain well in the long run. Liver cancers, liver and cholangiocarcinomas, very good results. In other locations, the results are similar to photon-based treatments, however, the side effects are less.
Right, that's been a very exciting conversation. You had this session with Nigerian oncologists, and currently we don't have proton beam radiotherapy in Nigeria. What kind of conversation are you having with the experts here in Nigeria?
So, I think the idea is that as oncologists, as doctors across the world, that doesn't change, that we want the best for our patients. We want them to have the best results. We want them to have the best quality of life, and a continuing interaction to, to educate each other, to learn from each other is a part of how we've always done things in medicine. And I think it's a part of the same process that we continue when we meet. So we share what we have learned, and our fellow doctors here share their concerns and what they have learned.
All right. Thank you for sharing those knowledge. Those, sharing of knowledge is really needed, especially for developing countries that require much of these global techniques.
Very true.
Dr. Sapna Nangia, right? Nangia. Thanks for being on the program. I'm going to be speaking with your colleague after this break. She's a senior radio oncologist from the popular Apollo hospitals in Chennai, India, especially the Apollo Proton Cancer Center, Chennai, India. We are going to take a break, and when we return, I'll be asking a couple of questions to her colleague, who will be telling us a bit more about what they are doing in Nigeria as regards to these global advancements in cancer care. Do stay with us. We'll be right back.
Every year, Nigeria have 115,000 new cases, new cancer cases, and I'm talking about those cases who got diagnosed and registered in the registry. I'm not talking about those who don't get opportunity to even reach out to the hospital. I'm just talking about the patients who got diagnosed in some government hospital and get registered. So every year Nigeria is having 119,000 new cancer cases. 5-year prevalence is 217,000 cases. Out of 119,000 cases, 71,000 cancer cases is of female and 44,000 is of male. Out of 71,000 female, 23,000 plus cases is only of breast cancer. So the problem, the cancer burden of Nigeria is this big. And we came here with a solution of it. We are treating Nigerians since many years now. Every year Apollo is receiving 100 plus patients in India. But our intention is not only to take patients from Nigeria to India, or for that matter from any other country to India. We are also trying our level best to do the capacity building at the country of origin where the patient belongs to.
Welcome back to Talking with Dr. Laz, your favorite health program on television. Yes, we've been talking about global advancements in cancer care, and specifically proton beam therapy, or a form of radiotherapy for cancer care that is providing additional solutions that is less harmful and less side effects. Joining me on this second segment is Mr. Amit Chaturvedi. He's the Deputy General Manager at Apollo Hospitals in Chennai, India. Are you also at the Apollo Proton Cancer Center?
Yes, I'm also part of Apollo Proton Cancer Center.
Okay, so good to have you. Last week, you had this continuous medical education with oncologists in Nigeria from National Hospital and different parts of the country. What is the objective behind that?
Yeah, so the objective behind it is, one is to make them aware about this remarkable development in the field of cancer treatment in the form of proton therapy, because most of the oncologists and the doctors from other specialties don't know about it. So make them aware about it. Secondly, we would also like to share our journey of treating more than 700 patients under Proton. Out of those 700 patients, we have a lot of Nigerian patients too. So so we want to share our journey of 3 years. So in last 3 years, we have treated 700 plus patients under proton therapy, and what are the outcomes, which all are the patients, and what kind of tumors get more benefited, and what all that data analysis we want to share with the clinicians here, because since long Apollo is treating Nigerians in India, and we are getting almost around 100 plus Nigerians every month in Apollo group.
On oncology or a different
No, Apollo group, yeah, 70% will be for oncology only. So we have a long time association with Nigeria as a country.
India is a major destination for medical tourism by Nigeria.
So Apollo is a second home for Nigerians, and for Nigeria is a second home for Apollo. So we also took in past we have took part in a lot of capacity building programs and clinical programs, developing clinical programs in Nigeria, training Nigerian doctors in Apollo system. So all that is also happening, and currently also we are in talk with lot of private and government healthcare providers to run some clinical programs and do a capacity building for the country, so that we are able to minimize this medical value travel from Nigeria to India for the things which are possible in Nigeria. So also we are in talk with National Hospital for training of the doctors and nursing staffs, so that the things which is possible in Nigeria, patients should not travel for
to India. That's really good, trying to transfer those skills so that we have less people having to travel to India for those services. Okay, lastly, how affordable is this proton beam radiotherapy?
To be frankly, Dr. Les, treatment of cancer itself is very expensive, even for Indians, So, but getting the right treatment, if you are able to afford it, getting the right treatment in right time is the key. So to getting the right treatment, you should know the place where you should be, So in Nigeria also, doctors are doing wonderful job. You have a very good oncology department in National Hospital, and even in Lagos Teaching Hospital. So you have a very good oncology department. The problem comes with the diagnosis part. So you don't have the right modalities, to diagnose correctly. So if you are affordable, India is the right option for you, because for the same proton therapy you are paying somewhere nearly around $200,000 in developed world like Germany, US, UK, whereas in India it's very much affordable. And as per my knowledge of Nigeria, we have different systems. Corporate houses are also supporting patients. Government is also supporting patients to get treatment. Then there are public sector units who are also sponsoring patients. Then you have public fundraising systems. So it is not that expensive that which is more than life. Yeah, so it is expensive in general terms.
You don't want to mention a range. You mentioned that in developed countries about $200,000.
Yeah.
So, but
let me tell you, in Apollo, the average cost of treating cancer is $8,000 to $10,000. Yes. So I think that is considerable, right? It's very much affording for a normal Nigerian.
Well, that's this kind of amount is for the very rich Nigerians, but I think this therapy is really bringing solutions in the cancer care, especially minimizing potential side effects that patients could have.
Just one more thing, one more submission.
Is really up. Okay, could you just
just one more submission. When we are saying it's for rich Nigerians, is actually not the case. The patients which we are accepting in Apollo system, most of the patients belongs to middle class and lower middle class family.
Okay, that's a good point there. Yes. Thank you, Mr. Amit Chaturvedi.
Thank you.
Deputy General Manager at Apollo Proton Cancer Center in Chennai, India.
Thank you, Dr. Les, for having us here and giving us the opportunity to tell our things.
Thank you. So hopefully at some point we'll have more of you when you come to Nigeria for this exchange of knowledge and expertise.
Surely, soon you will see Apollo footprint in Nigeria.
Great.
Thank you.
All right. Yes, it's been a very fantastic conversation with Dr. Sapna and Mr. Amit, both from Apollo Proton Cancer Center in Chennai, India. They were in Nigeria to exchange knowledge and skills with our specialists in cancer management. We hope that, like Mr. Amit said, we wouldn't have to be traveling out of the country many of the times to have some of this care. But it's good that, you know, this discussion is a bit technical, but for those in the oncology space, this is just an additional option that doctors will be presenting to their patients in a way that they could manage cancer with very minimal side effects. And of course, note that cancer is treatable, cancer is also curable, especially when it's detected early and treatment, effective treatment, is commenced in good time. Thank you for watching. My name is Dr. Laz Eze. I'll see you same station, same time next week. Bye for now.